appreciate you taking time to speak to the Greater Tallahassee Chamber of Commerce on what is really a historical moment. But I know our community wants to thank our healthcare providers and everything that you are doing to help us feel safe and to be there for us. So maybe first, if you can introduce yourself as well as your team member, but also talk about the Capital Regional Medical Center is doing for our community.
Sure, thanks, Sue, and great opportunity just to communicate how we're preparing for this inevitable event and a pandemic like we've never seen before. So I'm Alan Keesee, CEO at Capital Regional Medical Center, and with me is Ann Smith, our Chief Nursing Officer, and Ann's been a long-term Tallahassee resident here in the community. And so some of the things we're doing, first and foremost, I want to communicate how serious we're taking this issue. As everyone's watched over the past couple weeks on the news and really for months now, this is a worldwide crisis and a pandemic. And so we've been preparing actively as a company, as a local hospital for months. And those preparations are now starting to come to life. And I think that's what I want to communicate, is that our preparations are have been in full effect, and now we're walking through those active plans currently. And it's our responsibility to be there for our community, for our patients, and we take that responsibility as a sacred responsibility and know that that ethos is right now alive and well here in Tallahassee at Capital Regional. And just want to communicate our short-term plans and kind of short-term actions that are underway, as well as talk about the long-term plans that we've been put in place relative to the ability to surge in case our community needs that. So short-term really been focused on a couple things. One, we suspended our volunteer program. Volunteers are here every day providing comfort to our patients, handing out newspapers, and for their safety, we suspended that program over 2 weeks ago now. Our students from local community colleges, in order to mitigate their risk and exposure and the risks that they would have, our caregivers actually unfortunately suspended those in line with the local schools. Our visitation process and policy has been updated to ensure the safety of our patients and visitors. And then here locally, I'll call it vigilant infection prevention. That's really begun with limited access control. We've narrowed our entrances to 2 here at the hospital to ensure that everyone's screened, and those folks that present with symptoms might be appropriately cared for and isolated, and making sure they get the treatment they need. And then in this hypervigilant state, as you've seen, everyone's going out and buying cleaners and disinfectants. Know that we have a full supply in stock and a very well prepared environmental services team. Those are the folks on the front line ensuring we have hypervigilant cleaning of all of our surfaces, our areas, our hospital throughout. And the last point on the short term is really education. We've educated our entire workforce of 1,200 folks to be ready to provide the best infection prevention practices, here at the hospital. And those have been ongoing and continue every day. Let me pivot now to more the long term, as a lot of narrative across our country about a potential surge in patients. So some of the things we've been doing as a company are securing additional ventilators. That's been a coordinated effort, not only with the federal government, the state government, and local officials, but we've increased our ventilator capability by almost triple here locally in the hospital in case we need those. We've also delivered and set up different care delivery sites or zones for patients to ensure that we can provide the appropriate care and the appropriate infection prevention isolation protocols in place for those zones. And then I just do want to reiterate again, extremely high coordination with our federal government, state government, and our local Leon County Health Department to prepare for any pending surge. At the moment, our hospital has full capability for that. We actually are one of our lower census times of the year and of this, last couple of years. So we have plenty of capability locally at the moment to handle a surge.
Good. Well, thank you. I think that's important, and it's so important for our community to know. I think obviously within the last week, there's been a change with cases being in Leon County. You all were on the front line of that. Maybe if you can speak to that and talk about everything that was in place when that occurred and moving forward through that.
Yeah, so as the Florida Department of Health notified all of our residents, there's been 3 confirmed cases here locally. And so we were, on the front lines of that, as you mentioned this past week. The point I'd like to make is that we treat patients with infections every single day that vary from influenza to HIV. And regardless of what patients come to seek care for, we're going to treat them with respect and dignity. And that's exactly what happened in this case at this time. And so our screening protocol was in full effect when the patient presented. And fortunately, all of our staff and caregivers had full personal protective equipment. Isolation protocols were fully handled. And I'm grateful to say at this point, that the patient has returned to the community and, doing well, and we're moving forward as a hospital. So we're fully operational, fully functional at all of our care delivery sites, and look forward to, caring for every patient with respect and dignity.
Right. On that note, I think information is just so important, reminding individuals of what the protocol might be and maybe how you would want them to move forward. And you also mentioned your other locations. Within the last year, you all made a wonderful investment in our community and opened up emergency room sites. So maybe if you can talk about protocol for those moving forward, and then how those other locations are important to the mix as well.
Yeah, so all of our locations are fully functional, here at the hospital, including our emergency department in Southwood, our emergency department in Gadsden County, and here at the main hospital. The same protocols in place at all three, and really begins with screening. And I think that's in place at all those locations where we've moved triage forward to the doors or even outside the doors to ensure that patients are screened appropriately. So that'd be the biggest request of the communities, to really disclose and be honest when you enter one of those healthcare facilities, what your symptoms are, where you've been, and really adhere to those screening protocols. And Anne can talk a little bit about more community access on screening and some things we'd love to see our patients adhere to.
So one of the things I want to remind everybody, that the symptoms are very, very similar to the flu. So if you have a slight fever, cough, cold, those kind of respiratory symptoms, achy pain, want you to take routine meds that you would normally take. If you are concerned that you've been in contact with somebody that's COVID positive, we'd like you to contact your healthcare provider, your PCP. We don't want people that think they might be sick to go out into the community. That's the biggest thing. You need to self-isolate yourself with your family also, treat your symptoms. However, if you do get shortness of breath, any kind of trouble breathing, those are going to be the kind of symptoms that we would want you to come to the emergency department for, any kind of shortness of breath. So if you do need to come to the emergency department and you have someone that will bring you, have that person come into the emergency department. We want to make sure we mask anybody with any kind of respiratory symptoms as soon as they walk into the emergency department. And if we can get that mask to you even in the car before you come into the emergency department, that would be the best thing to do. However, we will mask you as soon as you come in, because we want to protect everybody in the hospital and our healthcare workers, and get you to a room as soon as possible.
Right. If other than these symptoms, obviously that there are other symptoms that are taking place and medical needs within our community. Maybe speak to that, because I know that you would still want individuals to be treated. Talk to that, if you will.
Yeah. So if you do call your primary care physician, that primary care physician will be able to get you tested. They can actually order a test online for you. There's a place, Northwood Center, that is doing testing in the parking lot. So if your PCP can get that order in, then you can go to that area and be tested right from your car. That would be the best way to be tested, as long as your symptoms, you don't have the shortness of breath and don't need to come to the emergency department. That's the best thing to do. We don't want you going into your primary care physician's office with these kind of symptoms, flu-like symptoms, fever, those respiratory symptoms. So we don't want you to be exposing other staff to this virus.
But at the same time, I do want to reiterate, fully available for emergencies. I mean, the medical community has really rallied. We're on the front lines and we're here, we're available. We still have patients that are in critical condition unrelated to COVID that we care for every single day. Cancer patients, patients with heart attacks, and we're fully available, and the entire medical community is ready to handle those emergencies.
So if there are any other symptoms, if you think you're having chest pain, unrelated, or a broken bone, or just any other service that you normally would go to an emergency room, you obviously still want individuals to do that.
Absolutely.
Absolutely. Yeah,
Yes.
we're fully capable and fully ready to handle any emergencies. We've had other emergencies in the last 24 hours that, just like we're here for 365 days a year. And that's really our call to maintain that availability no matter what.
Right. Is there anything else you would like to share with the community? And I know the community, first and foremost, wants to thank every single person that is working within your institution, and our medical providers, our nurses, all of the staff. So thank you all very, very much. It's very important. And maybe is there anything else that you want to share with the community?
I think one of the things I'd like to share is that, Alan talked about our visitation policy. That's the biggest thing, that we don't want the community coming to the hospital to visit patients. Obviously, if there are extenuating circumstances, we've limited a visitor to one person per patient. But obviously, if you're sick, don't really need to see that patient, you're not a family member, you're a friend, we would prefer that you not come to the hospital to visit. That's the biggest thing. We don't need the community coming in here.
And I think the other point to make is just at this time, we're all going to have shared sacrifice. I mean, we've all made huge sacrifices, but that really will benefit our caregivers, the patients, and to give us the ability to care for patients no matter what happens. And I think that we want to, and I appreciate the thinking of the caregivers, because it's stressful for us too. It's stressful for our employees. A lot of our folks are nervous as well, but know that our hearts and our ethos is that we're going to be here. We're going to be available no matter what throughout the duration of this event. And we take that responsibility really, like I said earlier, as a sacred calling. So we're here for you. We're here for the community, and ready to serve.
Wonderful. Alan, thank you so much. Ann, thank you as well. We hope we get through this quickly, but we're so proud and happy to have you here to support our community. Thank you very, very much.
Thank you, Sue.